program, and she's a member of the OCLC Membership and Research Leadership Team. She's been with WebJunction since 2007, prior to which she managed the book and magazine division for an international engineering society. Little known fact about Sharon, she's originally born and raised in Connecticut, but now she lives in Bellingham, Washington. So please join me in welcoming Sharon Streams.
Thanks so much, Jennifer, and thank you for inviting me to be here with you today. I'm really happy to speak with you, and I am going to start sharing my slideshow to anchor my talk today. So I am here representing the REALM project, which stands for Reopening Archives, Libraries, and Museums. Understanding that reopening isn't quite the right word, because libraries have been open the whole time, just in a different way. But it made such a great word, so we had to run with it. So first, I just want to tell you a little bit about the project, a little context setting, and to introduce the partners that have been working together on REALM. One, I have to give it all to the Institute Museum and Library Services. They were really the impetus for this project and the primary funder for it as well. But also, they also brought in funding from the Library of Congress, from the Andrew Mellon Foundation, and the Carnegie Corporation of New York. So they reached out to OCLC and Battelle to design and conduct this project. So OCLC is responsible sort of executing all the project deliverables, which is really pulling in all the input from across the three sectors that IMLS serves, and then pulling together the research and producing the finding and other examples from the field and outside the field, and communicating it outwards, and also doing presentations and programming like this. And then Battelle, which is a research institute that has decades of experience researching scary infectious agents, everything from anthrax and the SARS and MERS and such. They were asked to both conduct laboratory research for the project, as well as do desk research around the emerging science as well. And then another key partner have been representatives from libraries and archives and museums, which you're going to see the acronym LAMS throughout here, just because that's a mouthful. And they, those representatives form both the Executive Project Steering Committee and an Operations and Scientific Working Group. And these are both representatives from specific, individual institutions, as well as member organizations and support organizations for the field. So what have we been doing since we started back in April of 2020? We've been reviewing and summarizing the relevant scientific research specific to the virus that causes COVID-19, engaging with subject matter expertise within and outside of our sectors, conducting the laboratory testing and publishing findings. That was in what we're calling phases 1 and 2 of the project. We are now in phase 3. Creating Toolkit resources for LAM staff, and producing publications, webinars, and presentations for y'all. And then another part that we're really involved in right now is sort of gathering and pulling together and synthesizing and sharing the accumulated learning that has happened. We were all kind of in day-to-day crisis manage last year, so we have a little bit more of an opportunity to step back and say, okay, what did we learn from that, and how might we go forward? So this project is intended to continue through the spring of next year. So we're still in it, a 1 year in. And I just wanted to kind of put a little extra context before we dig into the sorry, I forgot to advance my slide, before I go into the specifics. And one is that we are, again, focusing on scientific evidence and research findings specific to SARS-CoV-2. So that's the virus that causes COVID. That relates to the operations, the day-to-day operations and policies and practices of libraries, archives, and museums. And this is serving across the whole US, and also it's shared internationally for institutions to use the information that comes out of the project, but to pair it along with local data, local sources, local expertise to inform your practices and your policies. So we are not in the position to issue one size fit all recommendations or guidelines because really every institution is different and needs to make decisions in context of your local facility, your services, your staff, and your community. So I'm going to just do a bit of a brief overview of the status of COVID-19 research that's accumulated over the past year. And starting with the research questions that drove our work in last year. And the three questions are here on this slide. One is, so how might the virus spread through general operations of your facilities? How effective are various prevention and decontamination tactics that are available to us in the near term, that and sort of pragmatic tactics. And then third was, how long does the virus remain active on materials and surfaces that are commonly handled or used in library, archives, and museums? So this is really meant following closely the science across a variety of disciplines. So we had to look at microbiology, epidemiology, immunology, biochemistry, physics, data science, social psychology, and public health. And each of those disciplines has studied these questions from a different perspective, and actually the findings that they offer didn't always fit together neatly. So that was one thing that we had to grapple with. How do you summarize these different perspectives into something that becomes useful information for for you? So what it required to do is with Battelle is to systematically review the published literature, anything that was openly available through the scientific publishing, and then summarize what was being seen, a lot related to these questions. Quickly, we became familiar with what we referred to as the known unknowns, and there are three that were definitely fully unknown for a large part of the last year. There's some emerging information about each of these, but it's still, there's not a definitive answer yet. One is, how much virus does an infected person shed? So that's if they're coughing or sneezing, how much virus is in there that's gonna be come off from them, and then also how much virus someone can pick up from an object. So if someone sneezes on it, then and when someone grabs that object, how much will they pick up from that? And then really, this is all related to, it's not fully known yet how much virus is needed to cause infection. So some viruses, you just need a few particles in your system to get the actual disease from it, infect the and others you might need, 1,000 or more particles in there. So there isn't a definitive answer about how much of it. So with that, we felt it was good to take a little bit more of a conservative approach, is to say, without that, here's information that says, if it's at the lower end, how you could be, if I should say lower end of infection of viral load, if you only needed a few particles to get infected, then that's good information to know how much is laying around. And then if we find out that it's a much higher load, then we know that we've taken some precautions. So as I sort of mentioned, there still has yet to be a research study or studies that have provided definitive evidence to resolve those questions completely. And boy, I know we all wished for really clear and consistent answers, but unfortunately, that's just not how science works. But what we have seen as a steady accumulation of evidence that when pulled together tells a story that a growing majority of researchers have coalesced around. And so, as we've seen through our recent literature research, and has now been reflected in recent communications from both the CDC and the World Health Organization, there's now general agreement that that SARS-CoV-2 travels through the air really easily, both through large respiratory droplets and through small aerosolized particles. And and of course, direct contact between people, but that transmission via materials and surfaces is a less common source of COVID-19 infection. In fact, we've heard from some scientists who claim that there's essentially no risk of transmission via materials based on kind of triangulating to studies of other viruses, such as those that cause the common cold or HIV. But that isn't, settled yet. So again, we sort of are staying on the conservative side of that question, but at least there's a general understanding that there's a lower risk. There's also evidence that transmission via bodily fluids, so saliva, tears, urine, that might also be possible, and research is continuing around that. And then also research is showing that environmental factors such as temperature, the humidity level, the quality of the air, and the flow of the air as being influential around the spread of the virus. Again, additional research is needed to understand the complexities of these variables, especially when you mix them together. I'm going to talk a little bit more about the airflow one a little bit later. So while there's still some unanswered questions about the transmission and the infectious dose of SARS-CoV-2, there is much greater understanding about how to reduce the risk of transmission when you're not vaccinated, particularly wearing a mask, keeping physical distance, doing good hand hygiene, toilet hygiene, being around fresh, clean air. All of that has been shown that no matter what the transmission route, those are effective practices. And we've also really seen that we've typically not needed expensive new gadgets or anything like that. We saw some things being peddled out there for us to buy. But perhaps other than dealing with inadequate indoor ventilation systems, it's really been about building new, sort of personal, social, and work habits, and using some kind of common disinfection and protocols in place. Now, about that disinfection and cleaning, under certain conditions, then using surface cleaners and disinfectants or UV treatment can be effective, but there are some caveats around that. One is over cleaning to the point that it's not really having any additional effect on reducing the risk of transmission, but can actually cause harmful effects to the people doing the cleaning. It's inhaling, toxic chemicals, and can damage the objects that being cleaned, and then just the overall impact on the environment of using a lot of cleaning and disinfection. So there's definitely ample room for some new, more environmentally friendly products and cleaning to be invented, I guess, or put out there for us to use. But when something is considered actually contaminated, somebody comes in without a mask and sneezes on something, it is effective to use a disinfector to just wipe that off, and then you've mitigated the risk of transmission. I think the good news is that we've had a lot of conversations with people who work in libraries, archives, and museums over the past year, and um, everything what we've heard back is of institutions who have not been able to trace cases of COVID-19 among either staff or visitors back to their operational policies or procedures. And we frequently hear of community members who express their gratitude to their local institutions for putting their health and safety first, and who are really appreciative of the services and the programs provided during the pandemic, even those that have been adapted from in-person to virtual. So as the variants of the virus have developed and are showing up here in the US, the Realm Project has been tracking their potential impact on everything that I just said before. Is there any adjustments to how the variants behave that might mean adjustments to our protocols and practices? And then also, with the introduction of the vaccines, there's been a whole host of new questions that have come up around the policies and operational considerations for working with staff and community members who may or may not be vaccinated. And then as cities, states, and countries are relaxing their protocols and restrictions for the public. So we have these new set of research questions that we've started this year, which we call the 3 Vs, because oddly enough, they all start with V. So one is, in addition to the implications and the impact of the variants on vaccines, the third one is around ventilation. So as I mentioned earlier, that airflow, having fresh, clean air, has been shown to be an important way to reduce transmission, and conversely, stale air, uncirculated air or contaminated air can increase the risk of transmission. So we are doing some more focused research on that topic. We have produced a research briefing on the vaccines and Variance 1, and then we have a ventilation edition that's coming out this week. Vaccines, I expect that many of you are tracking these maps, and in particular in your state. And Jennifer, before you all come, was talking about the status of Connecticut with vaccines. But we know that anyone age 16 older is eligible for vaccine. I know there's some discussion about the children 12 to 15 coming up as well. And we've had these really recent new communications from the CDC about what fully vaccinated people can do, and how they might be able to adjust our PPE practices, like mask wearing. that's again an example of those areas that not, if you ask all those scientists and folks working in the public health field, there isn't a consensus of agreement, a full consensus of agreement about how quickly we resume such activities and relax our protocols. But you know, we do have that CDC announcement. Because meanwhile, there's still studies about what are the long-term impacts of vaccines. We still have a serious issue with vaccine hesitancy and the misinformation around vaccines. It's really playing a significant role in the rate of vaccination in our country. But also, we see how libraries and museums, as sort of their local trusted community information hubs, are well positioned to contribute to supporting health literacy and communications around public health. And as for variants, there are some variants and mutations that have been found to be linked with increased infectivity. So it's easier to get infected from the variant than the original version of it. But on the upside, we're seeing that there's vaccines that are being shown to be effective against these variants. So that's really great news. Again, there's unknowns that remain around the variant, such as whether you can be reinfected with a variant after being infected with an earlier form of the virus. And again, that's if someone was not vaccinated. Also, whether certain demographics, for example, older people, are more vulnerable to variant infection. And then also whether the infectious dose, so how much virus you need to be infected, differs for different variants compared to the original. So plenty still to research around that. And then we have ventilation, which is, like I said, the sort of newest research question that we're digging into. And it's a complex also, because when you're looking at transmission of the virus, I mean, there's air flowing inside of a space, but there's also what's happening inside that space. What are people doing? Are they running around and breathing heavily? Are there a lot of them crowded together? Is anybody in that room infected? And how much virus are they infected with? And then the process of the air exchange. So how frequently is fresh air being circulated into the space? Is this through natural ventilation, like windows, open windows and doors, or mechanical ventilation, your HVAC systems? And then is there air filtration, anything that's helping to clean the air, so that the virus particles aren't hanging on with other particles that are in the air. The early research is indicating that while purifying the air and good ventilation are effective at reducing transmission, really it's not enough. It's much better when it's combined with other mitigation measures such as social distancing, mask wearing, in addition, especially when you have, depending on those activities and the number of people in the space. Also, just a presence of an HVAC system is not enough. I mean, if it's not designed or modified to truly maximize the circulation of bringing fresh, clean air in and getting stale, dirty air out, it could actually worsen the spread of the virus. Or if it's the ventilation is inadequate or isn't positioned well, then you might end up with sort of hot spots, or or actually just adding more virus to a particular space. Some research that coming from the global, some global studies are showing that kind of older drafty buildings actually can be a plus, especially those with, there just aren't that hermetically sealed modern building where you can't open any windows and it's all really well insulated. If that doesn't also have great, HVAC and other systems, that doesn't work as well as a as a drafty building where you can, and with real windows that you can open up to get the fresh air in. So yes, hooray for drafty. I know, big thing with Connecticut. Plenty of open questions around ventilation. So, I mentioned some of those factors, but there's still not a consensus on how to best configure or upgrade or design ventilation systems to mitigate virus spread. I mean, great. There's some professional associations of where this is their field and this is their business, and so we have been looking at the best practices and protocols that they issue as well to see what might be useful for libraries and other institutions. But sometimes, those best practices are kind of asking for Cadillac, level, very, very expensive, impractical, equipment. So anytime we can see something that's more within reach of more libraries, we're going to share that information. Also, just anything just more about that positioning of ventilation systems and air purification devices, how that can change the amount of the virus that might be present in a space. And then again, with the variance, when you add variance plus ventilation, are there any differences there? Okay. So if I didn't say this already before, so we regularly produce research briefings that summarize and update as new research, new information comes out around those 3 topics. Then I just want to briefly talk about the lab testing that we did during the earlier phases of the project. So OCLC and IMLS partnered with Battelle to conduct a series of 8 laboratory tests on materials commonly found in archives, libraries, and museums. And the research question was to study how long the virus remains active on these surfaces. And this lab testing was designed and conducted when it was thought that transmission via objects and surfaces was considered or perhaps the primary form of transmission. And so I just want to repeat that the growing consensus is that while the virus can remain active on the surface for hours or days, there's really a low likelihood that people will get infected through this path. I am not going to say a no likelihood, but I can say low likelihood. Just a quick description of the testing itself. So I said 8 test rounds, but we tested up to 5 materials in each round, and Battelle placed droplets of live virus to each material surface in this stuff that's it was a synthetic saliva, so it was sort of simulating someone sneezing or coughing on a material. And then they used a cell-based assay method that is used to measure how much infectious virus is still present on the material surface at selected time points, and then sort of tracked how the sort of timeline of how quickly or slowly the die-off of the virus occurred. And then the materials were stored in either a stacked or an unstacked configuration. And for most of the tests were held at a standard kind of office temperature, the 68 to 72 degrees, and humidity of, around 40 40% relative humidity. The final two tests, test 7 and 8, we retested some materials at warmer and then colder temperatures to see that effect of temperature on the virus. So here's just a snapshot of the results across all of those tests in visual form. And basically what you see for each virus, there's a variable length of time, anywhere from less than 1 day all the way to longer than 8 days for the virus to fully dissipate. But generally what you see is a rather steep decline in the amount of virus from the amount that was placed at the beginning till after just an hour of drying time. It's already gone down quite a bit. And then a real variable length of time for it to die off after that. We also saw that the materials exposed to warmer temperatures and materials that were in non-stacked configurations showed a faster rate of decay than the materials that were held in colder temperature or in a stacked configuration. And I'll just sort of note, thank you to my colleague Nancy, who's been putting links to the pages on the Round website that have all the details around everything that I'm saying here. So yes, as I mentioned before, everybody had to sort of deal with this deluge and sometimes not tidily stacked, fully answering all your questions materials and make policy decisions based on that. And so we just sort of offered some suggestions for things to do when making those decisions about policies. And one is to stay informed of the federal and the state and local guidelines, which I'm sure you all, I'm sure you all doing. I know we all became familiar with our county public health and our state government websites, as well as the CDC. When I'm just seeing the question in chat, and I'll quickly answer that. LOQ means limit of quantitation, and this is something that is part of this type of laboratory testing that was done, where when there's enough virus on the material, the lab researchers can use a kind of a formula, like a mathematical formula, to calculate how much virus is left on the material. Once it hits the limit of quantitation, which in this case was 26 particles of the virus, then they needed to just look at the material underneath a microscope and like physically count how many were left below that. So it's kind of when it's getting down to very few virus particles, but because we didn't know how much or how little virus it takes to infect somebody, even though it's fewer than 26, we didn't know whether you only need 10 to get infected by COVID. So we continue to track it all the way down to when the scientists could detect 0 particles on the material. Okay, so making decisions about policies, as I just mentioned, looking at the guidelines issued by the government, and then, as we especially seen in 2021, is frequently monitoring the CDC guidelines for their updates on mitigation and decontamination protocols, because it's been the rate of updates has been accelerated dramatically, I'd say, over the last few months. So it's good to check that what's new page every week. And then if you're concerned about items from your circulating collection in particular, or in public used spaces that might be contaminated, you can consult the Realm results that will show you the lifespan of the virus or on the materials. And there's also some other resources on there that give from collections conservationists, experts who can give you some guidance about how to clean sensitive collection items without damaging them. There's been some great sharing among institutions about their policies and practices, and we just think that's been really helpful for for everybody to see what other institutions are doing and get those differing perspectives, but then understanding what needs to be adapted for your local situation. And then I think I've heard over and over from library leaders and others that just and staff how much they appreciate the sort of like open and frequent communication about what's going on and what your changing policies and practices are. So we've all kind of had to let go of waiting till we have all the perfect answers and have it all tidy. Instead, just say, we don't know everything yet, but this is what we're doing now. And that leads me to this wonderful sort of rubric that we found published in the British Medical Journal early last year by some scientists who have had a lot of experience working with pandemics, and they put out this sort of advice about basically things that you can expect to happen with the pandemic. And we found this enormously I don't know, empathetic to the situation that we and everyone was grappling with. And one is that they say you'll be working with flawed and incomplete data, and that's just sort of to be expected, and and just be open about that. And you're not going to get a final answer to many of your questions, and so it means making decisions with uncertainty, with some ambiguity, and that is uncomfortable for a lot of us. Also, it's just going to be complex. You're going to get conflicting information. There's going to be gaps in information. And there might be just even paradoxes. And again, that's something that it can't be avoided. And so you just kind of have to wade through it. Also, really smart people will look at the same data, interpret differently, and it's not saying necessarily, one is wrong and one is right. So it's good to seek out different perspectives of people who are, again, looking at scientific, real information, but may have different interpretations of it, and understand and making decisions based on that. And then another thing that we've seen is that you have laboratory testing and laboratory research, which will produce findings, but also it's important to see what's happening in the real world setting, which we've all kind of are living in a laboratory in that way. And the findings from real world can complement the findings from the laboratory and really offers a full picture. So what we've done with all of that with all of that complex and often competing and highly scientific research was to create Toolkit resources that attempted to kind of synthesize and distill and describe in a way that was specifically for libraries, for archives, for museums who just wanted to say, tell me, give me information that will be helpful in my decision making. So we have a host of Toolkit resources on the website that we've developed over the past year. One is that slide that I just showed you about managing uncertainty. It just feels like something to kind of like hang on your wall and look at when you feel like you don't know what's going on. Um, and then just some other sort of some checklists, some key takeaways from the literature reviews, sample plans from libraries and museums about how they were approaching resumption of services for the public, cleaning and disinfection protocols, and then sort of visual depictions of the laboratory testing. We've also done some video interviews with some subject matter experts and directors of libraries and museums and archives. In addition, we've produced some roundups from inside and outside the field. So these are resources that have been produced by other organizations and from institutions, examples of virtual programming, examples of policies around social distancing and masks, examples of communication to staff and visitors that are either, letters or signage, some thoughts about volunteer and docent management, and some communications around vaccines. This will continue to grow over the year. I also wanted to alert you to a really cool new initiative that's led by the Smithsonian Institute. And last month they launched this website, this web portal called Vaccines and Us. And the Smithsonian collaborated with several cultural organizations in communities across the nation to provide COVID-19 information and really great sort of pieces, from artwork and programming and other information that's really end user friendly to help people make an informed decision about vaccines and to help all of us just talk about vaccines with family, friends, and community. So I encourage you to check that out. The Smithsonian has been a great partner to the project. Coming soon. So this week we will be releasing a new research briefing that includes the ventilation related research as well as updates to what we found around vaccines and variants. We also have a video interview with the director of the Boston Children's Museum, who Carol is a member of our operations working group, and she's just wonderful. And we'll have some other videos with some other of the museum directors who are on our working groups coming out soon, and some more toolkit updates with some more resource roundups. So that comes out this Thursday. We also have a panel forum with the Society for American Archivists coming up on June 3rd. And for any of you who are attending ALA Annual, we will have a live panel discussion on museum library partnerships, and that's on June 24th. And we've learned a great deal over this past year, but many questions remain about how institutions can operate successfully during a public health crisis such as this. There's great interest among all of our sectors to gather and synthesize what we've all learned over the past year so that we can proactively help to build our institutional capacities and be better prepared to respond to future public health crises. So this is a big reason why the project is planning to continue through spring of 22. So we can pull this together, what has been learned, and we can discuss it collaboratively across the three sectors. We're going to continue to follow the science, and we'll publish regular updates to the research briefings. We'll continue to develop toolkit resources on topics that are relevant to your operations. We also are going to be submitting the laboratory research study to a scientific journal, so it becomes part of the body of literature around COVID-19, and it's going to be written in the context of of why this project came to be, and the work of libraries and museums. Our scientific and our operation workings groups are going to be diving into some specific areas, including managing physical facilities, as more and more of institutions are fully reopening to having people inside. Ventilation being one key concern, the sort of mix match of vaccinated and unvaccinated, and the ongoing development of variants being other concerns. Also, how to build additional capacity for offering more robust and sustainable digital services and programming in those times when we need to pivot in the future. And in addition, we'll be examining more closely the inequities within communities and institutions around these topics, and to determine pathways for more equitable outcomes. So to stay in touch with what's happening both immediately and longer term, if you aren't already, I encourage you to sign up for the Realm mailing list. You'll get an update about anything that's new, that's just been released, or that's coming up really fresh off the press. That's all we use it for. No, it's spam free other than that. So this is where I check in and see if you have any questions for me.
People, if you want to raise your hand, that's fine, or unmute yourself.
Hi, I have a question.
Carla.
Hi, thanks. So I'm thinking about board books, and I noticed that the virus lives about 4 days on a board book from the chart. And so we know those go in children's mouths a lot. Is that a way that the virus could be transmitted?
Yeah, that is kind of one of those gray areas, right? Because especially if the children's in the library right then, picks up the board book, slobbers on it, puts it down, then if someone picks it up, then that's very wet and active virus right there. And again, is the child infected, and how much? So there's no research that can definitively answer that question yet, but I think that good news is that certainly a wipe down in between usage, or a setting aside for an hour will definitely go a long way to reduce the risk.
Thank you, Sharon. That's helpful.
Let's see, I'm looking at in the chat. I'm wondering if you have any thoughts about flipping the switch syndrome, which puts pressures on public institutions to fully reopen. Yeah, the question around there, I could suggest that the videos that we, including the 1 or 2 that are coming out this week and that will come out, so they're from the museum folks, might be really helpful, because museums, many of the museums opened up last summer, early last summer, because museums are absolutely dependent on people coming to the physical space for them to have any revenue. So they opened early on and had to navigate being open during a pandemic. And again, as I said, just as we heard from libraries, museums have reported that they just did not have incidents of COVID-19 as a result of that happening. And so I think they've done a wonderful job with that. So they sort of speak to how they worked with the public to and their spaces to have them be as safe as possible. I think, yeah, the twist is that we also have what they also reported is people were very good about adhering to mask protocol, the protocols. They respected them in there, and but some of the institutions were in cities or states where the protocols were dropped early on. So, for example, Houston Space Institute, right? It's in Texas. The director said Texas had said nobody needs to wear masks. Houston was sort of, well, we'd kind of like to wear a mask, but the museum itself was able to request that their guests all wear masks coming in, and they said that the compliance rate was very, very high, especially among the children who were just all wonderful about it. So yeah, I think it's going to be a lot of that kind of social, it's a lot of it sort of social psychology that we all have to grapple with. I know as director of Web Junction that our perennially most most enrolled courses are dealing with difficult patrons and dealing with angry patrons. So I don't say lightly that I know that the customer service side of thing has is not for the faint of heart. So, and I recognize that this does add an additional wrinkle. But again, I'd say there's some great inspiring ideas from the museums who've been it for the past year, really kind of trying to walk that balance.
I have a question or a concern. My library's been quarantining books, and now that the mask mandate is being removed, it seems a little counterintuitive because how am I protecting the books in the library? I know I can't ask people for proof, and I think, it's on, a trust balance that they'll come in and be vaccinated. But if somebody isn't and walks in and opens a book, looks at it, I don't know, coughs on their hand, essentially, I'm doing this whole quarantining process, but it's bypassing that. So that's the confusion with me with the masks. I mean, to me, the mask was the kind of end game. We do all these other things, expanding time, having programs, and the mask was the final thing. But now the mask is the first thing, and it's kind of throwing off my sequencing. So I know when I speak to my board of trustees, how do I defend quarantining if people can come into the library with no mask potentially and expose the books, and I can't follow everyone around for every book they touch. So
yes, I know for the past year, it's been helpful to say, no matter what the path of transmission, wearing a mask, social distance, and washing your hands is gonna, it's effective across the board. So as long as we have that in place, we're good. And quarantine was sort of like an add-on. And so I absolutely agree. If you take those things that were just sort of across the board good and get rid of it, then quarantining may be more necessary because you are going to have, potentially infected people frequently handling your collection items, and you just don't know. Yes, I unfortunately don't have a great answer for you there, other than to acknowledge that is a bit of a conundrum. Again, I will say that there has yet to be evidence that shows that transmission has occurred from that path of someone, handling something that an infected person handled. It probably, but it's going to be more around, someone infected without a mask spraying, their respiratory droplets in the air. So I think, your airflow is probably going to be the most important consideration. We are talking about, we're designing a webinar that sort of to talk about this sort of staff and policy considerations with this sort of strange mixture of where we are right now. And so we think it's great timing to have this discussion and hear both what how institutions are handling it and what information and resources might be that we might be able to help provide.
I thought we'd take one more question, and we are at 11. We usually do a stop at 11. So if we took one more question, and then if anyone had one.
I have a question for you. We've been quarantining our materials for a week, and based upon what I've seen in your diagram, that seems like that really would take care of most material. We don't have anything leather, so or big leather, so we don't have to worry about that. And there's been some discussion on whether we need to keep that full week or if we should, reduce it. Where would you land on that as far as your thoughts?
Yeah, I would say that with the growing consensus that that's it's not likely to happen. Certainly, after a whole week is definitely go on the sort of most precautious side, and I think it's sort of dependent on, do you have active, are cases on the rise, is infection on the rise, and what's your local situation. Again, the sort of mask wear, the other protocols are going to do a really great job of mitigating transmission, and you might just do it on a case-by-case basis of of a particular object that was handled that you concerned that might be contaminated. So yeah, the other thing is the pivot point is we have some libraries saying it's really sort of crushing their operations to continue long quarantining. And I'd say, like, then you kind of make a pragmatic consideration, like, well, if it's just really making life extremely difficult for the operations, then shortening it should be fine. But again, if you're sort of in active triage of trying to flatten the curve in your community, then continuing it could be helpful.
Right, thank you.
Mm-hmm.
So I wanted to just wrap up, Sharon. I think that this was so helpful. I think that, the challenge is, of course, everybody wants to have an exact protocol and list that they can hold up and say, see, we have to do this. And, you've identified, and I think you raise a really good point about, everything has to be paired with the local information. And as you said to Trish, what's going on, and watching the changing environment and the changing situation related to cases and things like that. So a little bit of a disappointment for, I think, everyone who really wants to have that, you must do this, and it takes the decision-making away. But I think on the other hand, probably 99.5% of the time, we actually love that decision-making and independence and power. So, have at it, people. So I wanted to thank you for creating so much clarity, and providing background to the process, where the Realm project is going, helping people understand what tools they could find, and just, I think, also helping everybody understand. I think it was really, I just wanted to point out, I know Chris put in the chat about, our governor changing it. And I think you raise a really good point about, when we started this, we recognized and had to remember we weren't alone. And so our colleagues in Texas have been grappling, from day one, and other states. We've actually been, in a pretty informed and conservative environment, of which I think we should be grateful. And we can learn from others across the country. And it seems like now, being able to go the Realm, the toolkits, and being able to hear and see examples will maybe help us all navigate it, now that we're back into another critical phase with a lot of uncertainty and differing opinions to navigate. So I just wanted to thank you very much for bringing that perspective to our state and to our community. And again, Thank you. And thank you all for attending. We did record this. This will be up on the website. I encourage you to visit all the Realm toolkits and things. I know I checked early on. I probably haven't checked as frequently. And now that we know sort of maybe there might be, you know, Thursday to take another look, and that we should subscribe so we know when new things are coming out, that it wasn't sort of a one and done, and that this is a continuing support system. So thank you very much again to Sharon Stream from Realm and Web Junction, and thank you all for attending. If you have suggestions for our next month's coffee talk, please let me know. You can email me or let Amanda know. And until then, we will thank you all. Have a great day, and I hope you can get a chance to get out and enjoy the beautiful weather.